Like I said, compared to when I graduated almost 10 years ago to now, patients are coming in kind of talking more about this. They've heard of it from some of their specialists and medical doctors in the city.
Okay, so today I wanted to talk with you about SIBO, small intestine bacterial overgrowth, and how much of it you're seeing in your practice.
Great, yeah, it's a very important topic. I think it's a lot more widespread than is kind of known about regularly, starting to get a little bit more attention. Some people kind of coming in and talking more about it, but definitely need to get more information out there about this condition.
Absolutely. I mean, I graduated from Naturopathic College 10 years ago, which, it's not that long ago, but I didn't even learn about small intestine bacterial overgrowth when I was in school. And now I understand it's the root cause of a pretty high percentage of IBS cases, so irritable bowel syndrome. Yeah,
absolutely. And so I graduated 2 years after you did, and there was still no discussion of SIBO at that time. So I think that's part of it. It is kind of an up and coming condition. And I think it's really helpful for being able to explain the root cause of irritable bowel syndrome, because I do find a lot of people receive this diagnosis from their doctor or their specialist and don't really know where to go after that, right? So it can mean a lot of changes for them. I find a lot of patients get on the internet and are looking up, what they can do with their diet to help manage their IBS. And a lot of the information on the internet can be inaccurate as well. So that's why it's so important to kind of sit down with your patients, take the time to go through all that stuff and really get them thinking about SIBO and what it is and how it might get the root of their IBS.
Yeah, I mean, the Dr. Google thing is big, right? Like, we have all this information at our fingertips. And I find that looking things up on the internet, talking to family and friends, that can help patients identify possibilities, questions. But in terms of defining a treatment plan, it's never a good idea, because that's just widespread information. But here we're able to offer our patients an individualized treatment plan.
That's right. The individual piece is so important, right? I think that's the problem with the internet is there's so much nutritional information out there. There's so much research that's been done. Some of it is great, some of it is poor, but it's hard to know as a person without education in that area what is, stands a reasonable chance of being helpful for you. So, that's one strength of what we do, right? Is we have access to that information. We can kind of tease apart. I always talk to patients about, let's tease apart your diagnosis of IBS. Let's take it a little bit deeper, because, no two people with IBS present the same way. There are different symptoms that kind of come with that diagnosis.
So let's talk about those symptoms. Let's talk about the range of symptoms that might end up falling into this IBS diagnosis.
Yeah, so there's a cluster of them, like I said. So for some people, it's bloating, general feeling of indigestion, gas, either belching or flatulence, upper or lower, cramping, bowel movement changes, so loose stool, constipation, heartburn, all that stuff. Really, really common with
reflux too, right?
Reflux. Heartburn, absolutely, like nausea.
Even bad breath has come up with some of my SIBO patients.
Absolutely. So it is a real cluster of things. And, usually my patients don't experience all of those things, right? They, pretty miserable, state if they did. It's some of them, right? And it's the timing, right? It's some of them are getting symptoms hours after they eat. And for some people, they haven't even put down their fork and they're experiencing, indigestion and bloating and discomfort. So all of that is important information for figuring out what is at the root of it.
It's pretty brutal for people, though. Like, some people have mild symptoms, but for some people, it's really affecting their quality of life.
Absolutely, yeah. And it is an uncomfortable thing. Eating is essential, right? We do it every day, multiple times a day, and it's also very social. So for people that really are experiencing trouble with these things, it can be embarrassing and uncomfortable and cause a good degree of anxiety, avoidance behavior. Like, you don't want to go to that social activity if you might be uncomfortable or gassy or whatever afterwards. So it is really important, especially if people are feeling frustrated because they don't know how to manage it on their own very well. So that's really where we come in.
Yeah, totally.
Yeah.
I find also that my patients who end up having a SIBO diagnosis are also tired.
Yeah.
They're pretty tired because this bacteria that's been hanging out in their small intestine is messing up their digestion. So they're not able to really absorb nutrients from their food or sometimes even from their oral supplements properly.
Yeah, absolutely. So condition like that or many other things kind of behind IBS, inflammation, SIBO will lead to inflammation, which is going to impair the ability of the body to digest as well. And absorb. So yeah, absolutely. I think it's a really common thing too. Yeah.
So, why don't we tell people about the testing? Like, how do we test for SIBO?
Yeah, sure. So if you come in and you're sitting down with someone and they have IBS, they have a lot of the hallmark symptoms for SIBO. So certain symptoms of IBS are more closely tied to SIBO than others. So
this is the catchphrase that I've noticed.
Yeah, go for it.
If we're talking about like bloating, this patient who ends up having SIBO will say, I'm so bloated, I look like I'm pregnant.
Yeah.
And it's so weird, but almost every time that somebody says that, when they're expressing the intensity of their bloating, almost all of those folks test positive for SIBO on the breath test.
And I absolutely agree. Bloating is the number one symptom that you have to rule out SIBO. There are other causes of bloating, but SIBO is a really, really likely one. And when I hear that, you start kind of digging into their history a little bit more. What are the things that can potentially lead to SIBO, and are any of those things kind of present in that particular patient? Talking about their diet and when they experience those symptoms, a lot of patients, not all, but some have kind of clued into different dietary triggers that are more likely to cause bloating than others, and that's really important information as well. So yeah, I agree. Bloating is a big one, and bowel movement change is the other one. If you're bloated with either extreme constipation or episodes of diarrhea,
or back and forth.
That alternating pattern that people hear so much about being associated with IBS, it might not really be IBS, it could be SIBO. So
it's so great that we have access to these tests now. So
absolutely.
The tests are great. They're only $240. And I'm finding that people's insurance is often covering it because it's a medically necessary test. So that's so helpful. I do usually warn my patients. They'll say, okay, it's a bit of a science experiment because you have to do a 1-day prep diet. It's the only day your naturopathic doctor will tell you not to eat fruits and vegetables.
Good
point. You're only eating meat, eggs, like white rice. And you're trying to take all the fiber and sugars out of your diet for that day. Then you fast for 12 hours. And then in the morning you take your lactulose solution. And then you start breathing into a test tube every 20 minutes for 3 hours. So that's the science experiment part of it, right?
Yeah, and you're hungry by the end of it too, right? Because you've been fasting. You fast. You eat that restricted diet the day before, and then you fast for 12 hours before you can start the collection. So, and then you collect for 3 hours. So people are definitely hungry, but it is like a science experiment. The testing is really accurate too. So
I found
it's reliable. It will tell you whether or not SIBO is present. It will tell you the type of SIBO, which really influences the type of treatment that you get. And really the test results will dictate the direction you take going forward with treatment of SIBO. So it is an important step in diagnosing this condition and separating, is the IBS caused by SIBO or is it something else, right?
Yeah, and I found patients are so validated to just know that there's something behind their digestive symptoms. They're like, okay, so there's either bacteria producing methane gas, bacteria producing hydrogen gas, or sometimes both. And it says it clearly on the interpretation of the test, and that's validating. But then, of course, patients ask me before they do the test, they're like, well, if I'm positive for SIBO, what's the treatment? Is it affordable? So maybe we can talk about our 3 primary treatments, because there are 3 that are
3 big ones that are used, and I'll often talk about the phases of treatment too. So it changes up. It's not the same for every single patient, which again comes back to that kind of individualized treatment, right? So you really have to meet the patient where they're at in front of you. You see a range of different responses to the therapies too. So so the 2 big classes of SIBO are the hydrogen dominant, which is typically associated more with loose stool and diarrhea, and then the methane dominant, which I always will tell patients is the more kind of retractable, difficult to treat type of SIBO. So, and that's more constipation dominant. So depending on the type, you select different medicines, different kind of herbal treatments to address those things.
Awesome. So every once in a while you get a stubborn case, right? And we don't have to go too far into those because they're really in the minority. I don't know what you see with your patients, but for mine, when I diagnose them with SIBO and I get them on a protocol, they're usually feeling better within a week. And oftentimes they're symptom free within a month. Without major dietary changes. Which is huge.
And that's the most rewarding thing about it, right? As a practitioner, and to see your patient kind of do so well in such a short period of time without the kind of overhaul of their diet is great for everyone involved, right? So I'd say, sometimes you do get the stubborn cases. No two people react the exact same way. But I would say the vast majority of times people experience some significant benefit. So, at least, 40% improvement, 50% improvement, which, within a week or 2 weeks is great. Especially if that patient hasn't experienced any symptoms for years, right?
Like sometimes 20 years it's been, sometimes?
Like since a teenager, since childhood, experiencing these symptoms without kind of understanding why. So it's a really kind of big breakthrough moment for the patient.
I find it's a breakthrough moment for weight loss for some patients. Like I've had patients, mostly women, who come to me and they're saying, no matter what I do, I can't lose weight and I have these IBS symptoms. So I usually treat that first before we even look at potential hormonal influence, insulin resistance, all the other potential reasons why weight loss might be difficult. And so a lot of times you get rid of the bacteria that are in the small intestine, and then a healthy weight is easier to establish.
Oh yeah, absolutely. I'm always talking to my patients about the complexity of the digestive system, right? And it's easy to want to oversimplify. And, you think about calories. It is at if I minimize my calories, well, I certainly lose weight, and
calories
it might work
in,
for some
calories
people.
Out,
You got it, right? But it's not the answer for everyone. And then you really have to do some digging, right? You really have to kind of think about what else could be involved with this person's difficulty with losing weight. Certainly, bacterial imbalance like SIBO is a factor. And just making sure the digestive system is working in harmony, right? There's a lot of moving pieces there, a lot of different organs with different roles. You need to really kind of think about what is the role of each of those organs, and based on the person's symptoms, which one may be in need of some support.
Absolutely. So what are some of the most common causes of SIBO, this bacterial imbalance in the small intestine?
So quite a few. I always will ask about, a history of food poisoning or traveler's diarrhea. That's a really, really big one. If that is in the history combined with like bloating and indigestion, it's almost certainly SIBO. We know that a certain number of people, I think it's about 20% of people who experience food poisoning, their digestive system just never really recovers after that. They experience a type of autoimmune reaction, so a destructive process where the immune system kind of damages the body's MMC, or the migrating motor complex, the process that helps the intestinal system to kind of move things downward through the system. And without that kind of sweeping motion, people are more likely to get bacterial overgrowth.
Now, for the folks whose migrating motor complex is damaged, are they the folks more likely to experience constipation?
I wouldn't say that
Not
necessarily. I certainly wouldn't say that. I think it's a little bit more complex than that. I think it's, you really have to kind of do more digging into the types of foods and that kind of thing. The migrating motor complex impairment, I think, can lead to diarrhea or constipation. So
like it's too fast, too slow, something's not right. People know when something's not right too. I mean, we talk about the gut instinct, and I tell people, your nervous system, it doesn't just exist in your brain, it's everywhere in your body, and it's in your digestive system. So
no, absolutely. No, it's a really good point. Thinking about other potential risk factors, right? Other causes, things that kind of lead to SIBO. So I always check for a history of abdominal surgery is a big one. Pregnancy, especially multiple pregnancies in a short period of time, like that will slow down the movement of the migrating motor complex, intestinal system in general. People who've been on antibiotics for a long period of time, often the treatment of acne, can predispose to imbalance of
bacteria. People don't even think of that as antibiotics, but a lot of acne treatments, that's what it is.
Yeah, absolutely. So anything that's really going to interfere with the balance of bacteria in the gut, or slow things down. So, and not in everyone, right? Like some people tolerate these treatments just fine and don't develop SIBO, but it is certainly a risk factor for people, especially if their digestive symptoms come on in a short period of time, kind of after that or around the same time. Important consideration.
I was surprised to find out that even antidepressants, anti-anxiety medication, and the birth control pill can sometimes be the root cause of SIBO. Because at first I thought it was mostly just antibiotics.
Yeah.
But no, even those medications in specific people can start to damage the small intestine and create an environment where bacteria can grow.
Yeah, that's it. We're all individuals. We're all unique as we know, right? So yeah, some people tolerate those medications just fine, but you're right. I've seen those things come up in practice as well, right? Especially patients who've been on birth control for a long time, right? It can certainly be something that's involved. So that's when you start thinking if the kind of the usual suspects are coming up in this case, what else could be involved with the person's SIBO? Adequate protection of the digestive system too. Like I see inadequate acid secretion in the stomach as a factor as well.
Low stomach acid.
Low production of stomach acid, right? So that serves as a barrier so that the acidity of the stomach is effective at eradicating things that may be contaminated, contaminants that may be kind of on our food and that kind of thing. So that's a common factor as well. And the acid also serves to trigger that MMC, to trigger movement and motility. So with low acid production, not only do you have less of a barrier, but you have less of a stimulus for the digestive system to kind of get moving. So it's an important thing to address. Those are patients who often experience reflux shortly after eating, along with their bloating and that kind of thing too.
And that's interesting because a lot of people associate reflux or heartburn with stomach acid that's too high.
Yeah.
But often it's actually the opposite. It's like your stomach acid's not optimal, the production's not there.
Yeah.
And then you get reflux because things aren't moving down the way they should.
That's right. Yeah. I'll never forget, I had a professor at Naturopathic College who said it's not that a person has too much stomach acid that causes reflux, that the acid is in the wrong place at the wrong time. So it's just figuring out how do we get that acid production up in association with meals, and how do we keep it in the stomach? How do we prevent it from kind of splashing up into the throat and the esophagus, that kind of thing. So reflux is involved with SIBO. There's a mechanism there too. So not maybe the most common symptom, but can definitely be associated with that condition as well. So
Absolutely.
Yeah.
Well, I guess we just like to get the word out, right? Because so many patients who come and they learn about SIBO and then they feel better, they're like, wow, I wish I would have known about this years ago.
Yeah.
So I've been encouraging my patients to tell their family and friends, if anyone's experiencing these symptoms, they should definitely give us a call.
Yeah, and it's working. Like I said, compared to when I graduated almost 10 years ago to now, patients are coming in kind of talking more about this. They've heard of it from some of their specialists and medical doctors in the city. Practitioners are more open to prescribing pharmaceutical treatment because that is an option as well.
Yeah, there's even an antibiotic that a family doctor and nurse practitioner can prescribe to eradicate SIBO.
That's right. Yeah, specific for the hydrogen type, especially. Yeah. But this wasn't really on doctors' radars, at least not to my knowledge, when I graduated compared to now. So there's a lot more kind of collaboration happening in the treatment of SIBO. People are more open to this diagnosis because I think they're seeing the benefit that the patients are getting when they're addressing this. So it's important.
Absolutely. Well, I'm so glad we were able to have this chat today.
Yeah, it was great. Yeah, always good to sit down and talk. Yeah.